You're listening to FitPro Sessions with Parallel Coaching, episode number 14. Hi, I'm Neale Bergman, and in today's podcast, I'm talking to Kyle Simpson from KS Sports Therapy, all about sports therapy, injury, and tackling pain with clients. So stay tuned. Hi, I'm Neale Bergman.
And I'm Hayley Bergman. Over the last 10 years, we've helped thousands of fitness professionals to get qualified, learn with simplicity, and coach clients with confidence.
We're the first to say that learning and being a fit pro doesn't have to be hard work, and that with the right structure, support and resources, you can become a confident and knowledgeable fitness professional that is dedicated to more.
So how do you learn, qualify and kickstart as a fit pro? This is the FitPro Sessions Podcast with Parallel Coaching.
Good morning, San Diego. I think it would best start with a Ron Burgundy quote. Good morning, Kyle. How are we doing?
Morning, mate. Very well. How are you?
Fantastic. Yeah, very well. A huge welcome to FitPro Sessions, episode number 13, I believe. And obviously you're on. We're talking all about sports therapy today and understanding injury, understanding more about what you do and how you help people get fighting fit. So I want to kind of throw it straight over to you. Tell us more about who Kyle Simpson is and KS Sports Therapy.
That's a big question, mate. So I started KS Sports Therapy about 4.5 years ago now.
Yeah.
And ever since, I worked out of Plymouth Performance Gym. I moved with them, and now I'm in my own sort of new clinic, which I've been in for about a year now. And we tend to be quite busy, which obviously you can tell because it took us a while to schedule this podcast.
Yeah, completely. That's a good thing, right? It's good to be busy.
Oh, definitely, mate. Yeah, it's better than it puts food on the table and I like to eat, so it's a good thing, isn't it?
There's a good way of looking. I like to eat.
Yeah.
So from a sports therapy perspective, what made you get into sports therapy in the first place? How long have you been doing it?
So I've been doing it with uni and obviously having my own practice and stuff and working in other places about 7.5 years now. The way I got into it was when I was a kid, I wanted to become the heavyweight boxing champ of the world. Realised that wasn't going to happen. Started studying law at A-level, which I kind of enjoyed, but it wasn't really me.
Yeah.
So I remember being at a university fair, panicking when I realised I didn't want to actually do law. So I saw the Mahjong banner there, or the stand. Thought, right, I'm sporty and that's in Plymouth, so I just applied for everything I could. When I got my UCAS results back, I started to actually look, thinking, do I want to be like a strength conditioner, a sports therapist, an outdoor ed person? And I kind of was just thinking, right, I'm getting injured all the time in boxing. I may as well at least be able to fix myself. So I kind of just picked sports therapy on a bit of a whim, to be honest. But luckily, after about 2-3 months, I really, really started to enjoy the course. I loved the impact it could have on people.
Yeah.
And I just really enjoyed the content I was learning. So from there, I kind of just thought, right, sort of, what's the phrase? All guns ahead, going like that.
All guns ahead completely. Yes. So you jumped straight into sports therapy. So 7.5 years of sports therapy. I'm guessing your anatomy and physiology is pretty good.
Well, I know what I need to know, mate. Yeah. Probably.
Don't worry, I've not got a list of questions here around, what is the origin of this muscle or the insertion of that?
Well, mate, I've got my books and I've got my posters, so I can always cheat if I need to.
Fantastic. Truth be said, it's behind me as well, just to double check.
No.
Cool, man. Cool. So you went ahead, you got your sport and exercise rehab degree. You've been in business for a number of years, based down in Plymouth. What was it like going through those qualifications? As you know, a number of our parallel learners, they go through the level 2, level 3, fitness instructor, personal trainer, Pilates, yoga and whatnot. And they have to learn, obviously there's a number of modules, but the main one most people get stuck on is muscles, origins and insertions and locations and understanding of the muscle structure. What was it like for you, coming from an A-level perspective, studying law, not really knowing kind of where you're heading, and all of a sudden you're jumping into this minefield of information, Latin words, left, right, and centre. What was it like?
At first, it was a little bit overawing. I remember the only word I actually knew was posterior and biceps. So, so yeah, that was pretty much it. But with all of my studies and stuff like that, I've always just been very bit of a nerd. Basically, I've just always put my all into it. And with sports therapy, it wasn't much different. I actually really enjoyed learning anatomy because there was no if, buts, or maybes. It was just like, this is the muscle, this is where it originates, this is where it inserts, this is what it does, and then that was it.
I'm with you on that. It's black and white, isn't it? There's no
exactly,
grey areas. Yeah. The muscle originates here and it inserts here. It does this movement. It can't do anything else. And I think once you get your head around that black and white concept, it's just that for me, it was a systematic approach and just learn the muscles up through the body.
Well, yeah, and that's the thing. The body's basically a machine anyway. So you just learn it like that. And I remember one of my lecturers always said to me, once you know anatomy, you just know it. And that's pretty much the case. So anyone like listening who is studying, it takes a bit of a while to learn. It is a bit of a pain, but it's just got, such an all-encompassing benefit. Firstly, if you're obviously treating people with sports therapy, you know what to work on. And then when you're coaching people as well, you know what muscles to target and you know what actions or exercises are going to target those muscles.
And that's key. Something that we're constantly barking on about and shouting pretty loud about a parallel is the importance of knowing your anatomy and physiology outside of the exam and the impact that has on, if I understand muscles of where they start, where they finish, and where they pull from, and what joints they cross, and what action is brought about at that joint, I can now plan an appropriate exercise based on the client's goal.
Yeah, exactly. And you tend to find that obviously you do have some exercises, say like a bicep curl, which is meant to be like an isolate exercise as opposed to a compound. However, no exercise is really an isolate exercise because no one muscle works on its own. It has a lot of other muscles working with it. Yeah. Whether that's just to stabilize the core, to stabilize a limb, or to obviously aid in the actual movement you're looking at. So say sorry, go on.
No, go for it. Yeah.
I was going to say, like, even with like a bicep curl, I say that because that's obviously a favorite of mine. Even when you're doing a bicep curl, your trunk is working, your legs are working just to keep you rooted to the ground. And obviously you've got your flexor forearm muscles working to actually grip and to aid elbow flexion as well.
And I suppose from a sports therapy perspective, if somebody comes in with let's say an injury or a niggle lower body, let's say around the hips, that's obviously going to impact the core, which is going to impact the bicep curl.
Yeah, exactly. Yeah.
In turn, it could do. So just because someone's potentially injured lower body, and a typical response for a fitness professional would be, well, I can still train you, I can still train upper body, but that could impact the injury as well. Does that make sense?
Yeah, exactly. So you hit on a few good things there. Firstly, like if someone gets injured, we just recently put a post up about this. Being injured doesn't mean you have to stop exercise altogether. You can adapt. You can work the muscle in a different way. You can work the joint in a different way. For example, if you're doing regular bicep curls and you've got a bit of a pain there, try like doing hammer curls or something like that instead, because you're going to work more of your forearm muscles. And also, if an area is injured and then you're working another area, you need to be careful not to overwork it, because obviously then you don't want to have two injured areas as opposed to just the one.
Cool. Let's segue back towards your qualifications in sports therapy, your degree. What was the biggest takeaway you got from a course other than the bit of paper to say, I'm now qualified, Kyle Simpson's qualified? What was the other big takeaways?
Well, for one, so I went to Marjon and they are brilliant with the placements they get you. Yeah. So I did a lot of placements, and obviously it's all very well and good learning from books and stuff and various resources, but that hands-on experience it taught me was like crucial. And it, a lot of the stuff I learned, I felt like I learned more in practice than actually in theory. One of the best placements I got was at Plymouth Argyle, which turned into a job that I did for a while there as well. And I just learned so much on the job doing that as well.
What are your thoughts then? This is a completely off the cuff question now, just based on, it's not on the notes behind me. What's your thoughts then on these online courses for sports therapy and personal trainer courses that you see that have no attendance, that have no contact, that have no hands-on experience? What's your opinion on those?
So firstly, I'd say any information that's accurate is good. But you need accountability. You need people there to answer questions for you. So while these courses are good, you still obviously need, people such as yourself and Haley to bounce ideas off of, bounce questions off of, and really go to with all your concerns.
So then obviously you've got that hands-on experience. You can actually apply what you've just learned.
Yeah, and in terms of a practical aspect as well, you would obviously absolutely need placement hours and stuff, because it's all very well and good learning something off of a computer, but it's completely different when you're actually dealing with another person.
Yeah, completely. In a therapy room or in a gym, and I actually got hands-on thinking, shit, how do I put this together? I've learned about it, but there's no personal skills there to bring it to reality, if that makes sense.
Yeah, exactly. And I feel like, I don't know about yourself, but obviously you hear of these horror stories where people will just stick to a plan, and no matter how their client adapts to it, they just stick to the same plan, whether it's for better or for worse. And that would be something that could be avoided if they've got that hands-on experience through like placement or volunteering opportunities.
Completely. I love it. On top of that, you obviously done your sports therapy. What other qualifications or seminars or training have you done since to keep yourself kind of tip top? Because I've known you for a couple of years now, and I've seen we've changed venue. I've seen your client base increase radically, and I live down in Plymouth where you're based, and it seems like anybody that talks about sports therapy, they just say Kyle Simpson. How did you get your name out there, and how have you kept your knowledge up to date to make that happen?
In terms of getting my name out there, social media is brilliant for that, and I think word of mouth, as you know, is just like second to none, really, because it's such a sincere advertisement, really. But in terms of sort of additional qualifications, I'm part of BASRAT, which is the company that I studied under, or the organisation that ran my degree, and they tell us to do X amount of CPD courses per year, or X amount of hours per year. So that kind of forces you to, which is always good. But I've done, like kinesiology, taping courses. It's always good to top up your first aid courses. Other manual therapy courses as well. And one of the best for me in terms of, I think self-research and self-motivation is very important. And one of the best things that kind of prompts my studying or my further studying after uni is either I'll get a client in and they'll talk to me about their injury, and I'll be like, okay, yeah, I know that, but I don't know it as well as I should, so I'll research that a little bit more. Or just through like seeing people I follow on Instagram and stuff, they'll talk about a subject which I find interesting. I then like to post about that myself, but obviously I want to know what I'm talking about, so I'll research that quite a bit, and it all kind of just goes from there, really.
I think that's a really key point, and this has come up a number of times on the FitPro Sessions podcast from the people we've interviewed, and they've said, just scheduling time, perhaps not every day, but certainly a number of times throughout the week, whereby you're jumping into your own research and you're exploring or having these inquiry skills and questioning things you already know to further your own knowledge, and how important that is. Yet something I see or witness an awful lot inside of a parallel community, or just generally within the fitness community, is people aren't scheduling time to continue their learning. It's almost like I've got to go on a course to learn, but that reality is that's not true.
Yeah, exactly. And I feel like in terms of scheduling is so important, because otherwise your learning can become quite sporadic. I think it needs to be, when you study, much like with anything, it needs to be convenient for you to do it, and it also needs to be not too much of a time commitment, so it can be sustainable. So if people say like, I need to do 3 hours a night every night, that's not leaving much room for a social life and a whole balance. So I like to try to do maybe half an hour to an hour every day or every other day. But then, to be honest, because I follow a lot of like physios and sports therapists on like Instagram and stuff, I find myself constantly just reading their stuff, so you're, without realizing, you're just taking on a lot of knowledge anyway.
I love it. From all your research and courses you've been on, do you have a particular style or therapy that you enjoy most? Not that obviously you're going to prescribe that or deliver that, because obviously that'll be down to the client's individual needs. But do you have a particular therapeutic approach or manual therapy that you enjoy doing more than others?
Yeah, so it's more just the application of principles. So one of the biggest principles I use when dealing with clients is that everyone's body has sort of a level of tolerance that it can withstand. And when a client is to exceed this tolerance, that's when they're going to pick up an injury. Or simply put, when people do more than they can handle, they're going to get injured. So what I like to do with them is really just identify what's causing the injury, whether it be like a specific activity or exercise. Then we need to look to either eliminate that activity or just reduce the intensity of it temporarily. Then I can administer my treatments. Sports massage is always a very good one because it helps to obviously relax the muscles, which is obviously important being a musculoskeletal injury specialist. And then I like to, whatever caused them an injury, say if they've been squatting too much and it's given them a bit of knee pain, reintroduce load in the knee in a safe and appropriate manner until we can get them back up to squatting where their body's more able to tolerate the load of that exercise.
And I suppose the main route to get to that point with a client is just to have a really thorough consultation on right from the get-go.
Yeah, we always take our time to, even if someone comes in and says, oh, look, I've got like, anterior knee pain. I'm like, okay, yeah, you probably have. I mean, you clearly have, but I'm going to take you through this process. I need to ask about the injury, the origin, what aggravates it, what relieves the pain. Talk to them really about their pain and how it affects their life as well. Because when we can show people how improving their injury is going to, improve their life and get them back to doing what they love doing, that's when we really motivate people to actually, do the exercises we do, get them to turn up to sessions and stuff like that.
Because the reality is something I've come to you to have treatment a couple of times, but from the injuries or niggles that I've picked up personally, I know that when I've had knee pain, the likelihood of the therapy being around the knee is quite low. It's usually something else going on in the body that's causing the knee pain.
Yeah, exactly. And most of the time, the one thing we're really in charge of in our bodies, like instantaneously, is our muscles. And because humans make a lot of mistakes, that usually means that the cause of most injuries is some form of like muscular tightness. Then now that's not always the case, but significantly muscles tend to be the cause of most injuries we see. So while you might have, say, anterior knee pain, a big cause of that is tightness in the quads. So people will come to me and say, this is where it hurts, and I'll work slightly further up the chain. So rather than actually treating the symptoms of their pain, we'll treat the cause of that pain.
Super.
So like pain, although pain might be in one area, the cause might be somewhere completely different.
Just to add a bit more clarity, what do you mean by, I know what you mean, but just for purposes of the listeners, what do you mean by up the chain or down the chain?
So for example, if you look at someone standing and they've got knee pain, the pain is either going to be coming up or down the chain. So up the chain would be into the quads and stuff like that, and further down the chain would be further away from the trunk, maybe in the calves.
So seeing the muscles as a group or a chain of muscles working up the body or down the body.
Yeah, so obviously like a really well-known one is the posterior chain. And this is, again, what we were saying about muscles is they do just work collectively together. Although we've got all of our diagrams and stuff, which look brilliant, rarely do muscles actually look like that.
Completely.
when you see them, it's more they just work as a group, really. So if you've got a weakness in a chain, it can, say if you've got a weakness in your glutes, that's going to affect hip extension, for example. And then you could have an overworked hamstring because of an issue further up the chain in the glutes.
For example, right now I've got a dodgy left shoulder, which is having an impact on my mid traps, which is having an impact on my low back, which is having an impact down on my right knee. But the root cause is up here. But whenever I've discussed it with people and they've said, well, why don't you go and get your knee sorted? I'm like, that's not the issue, even though that's where the pain's presented at times.
Sounds like you need to come and see me, mate.
Do you know what? I'm pretty close. Let's chat after. There's a lot going on at the moment. Take on the injury then. Do you have a particular injury that if somebody walks into your consultation room and they go, I've got this pain, is there a particular injury or pain that you think, yes, that's what I want to work with? Or you enjoy working with most?
Lower back pain is a big one. I think the statistic is something like, say, 9 out of 10 people in the Western world suffer with lower back pain. And actually, so I've had 4 people in today already, and 3 people have had lower back pain.
Really? Wow.
So it's a very common one. I enjoy working on that, especially because it can affect people so much day to day, because you don't realise how much you actually need a healthy back to support, healthy living. Being able to fix that tends to have a massive impact on people, and that's what I like working on. But to be honest, like, I like working on that because of the impact it has on people. But then any injury is good because it, keeps my day fresh, and it keeps me wanting to revise and keep researching to stay on top of my game.
Completely. With do you have a particular sporting injury? I know you're big on kind of boxing and MMA and the fighting scene. Do you like working with the injuries that come out of that as a sport discipline, or is there a particular sport that you enjoy working with as well?
To be honest, any sport. I always like dealing with like combat sport athletes, like boxers and MMA fighters, just because then we can talk about like the fight I was on the weekend, or UFC or something. But I like a lot of the sports that are, maybe not in the forefront. So I've done a lot of work with the Plymouth Roller Derby girls, or Plymouth City Roller Derby. I've probably mispronounced the name of their club, but yeah, one of those. But that's always really good because it just gets you knowing about new sports, really. One sport that I see a lot of is a lot of CrossFitters. And I know CrossFit can get a bit of a bad rep, but I think it's a great sport. CrossFit's kind of like the mixed martial arts of fitness, because it just encompasses everything together. And it's, I see the difference it makes for people. They change their lives, they get a lot more healthy. And then I'm very motivated to like get them back to that, because, you want them to continue the progress they've been making before they got injured.
I think you're right. CrossFit does get a lot of stick across the fitness industry. Especially, I think you're either in the CrossFit camp or you're completely against it. I'm not against it by any means. I love it. I've done it. I've tried it. Got great results. But also I do recognize that if not, performed, executed correctly, it can dish out a whole host of niggles and injuries. But that's the same with any sport, right?
Exactly. Yeah. I feel like you said, that's the same with anything. If you do something too much, you're going to get ill effects of it. However, you can see how CrossFit, where it's a very rep-based sport, it can almost invite overtraining. But again, it's just all down to the individual, and hopefully the coach administering the sessions is very aware of that. And I know a lot of the people I work with, so I do a lot of work with members of CrossFit Plymouth. Yeah. And I know the coaches there are very on it with their technique and making sure people don't do more than they should. And that's very encouraging to see.
Because one of the things we teach on the level 3 PT and then the level 4 low back pain, especially, is this concept of overuse, misuse, and underuse.
Yeah.
So if I'm going to constantly, I don't know, let's say the frequency, I go into a CrossFit gym, let's say 5-6 times a week, and I'm performing loads of squats, loads of cleans, loads of jerks, loads of pull-ups, and I'm only staying inside one plane of movement, I'm just going to overuse the muscles of the joints in one particular way. Of course, you're going to pick up niggles. So it's understanding, and again, going back to the importance of understanding anatomy and physiology and saying, right, I need to move the body in all 3 planes and understand frequency of dishing out these exercises to not overuse a particular area.
Exactly. Yeah. I think it was Arnie that said it in Pump and Iron, like, you need to keep the muscle guessing.
What a
film. Great film.
It's on Netflix. Like, go and check it out if you've not seen it.
Well, yeah. Yeah, it's a really good one. But yeah, you need to just keep the muscles guessing, and, variety is the spice of life and all that. So if you're just doing the same thing over and over and over, your body's not gonna, after a while, your body's not gonna get the stimulus needed to adapt. So you're not going to be getting stronger anyway. You might just be staying and plateauing at the same level. So that's why incrementing your training with different reps, different range of motion, different intensity, or just changing up exercises completely just to work the muscles in a different way. Superb.
We've kind of demythed this concept that CrossFit is bad, which I kind of like.
Yeah.
Not that. So is there any other myths that you can think of? You think actually the general consensus is people believe this about a particular injury or a particular sport or a way of working the body, and from your experience, you go, that's just bullshit. That's BS.
Oh, so many, mate. So I think surgery is relied upon a lot more than it should be. And don't get me wrong, surgical interventions can do stuff that I can't do as a sports therapist, and they are very they're very beneficial, but only when they're actually needed to be. So if we look at, like, say, slip discs, for example, well, I mean, that even in itself is an incorrect term, because discs don't actually slip when people think that.
Tell me where they slip to, Kyle. Where are they slipping to?
Unless you've got a severe issue, your discs aren't going to slip. Your spine is a lot more robust than people think it is, and it's got so much there keeping it together in terms of ligaments and tendons that, you know, to actually slip your disc, you're gonna have to do something pretty significant. What more happens is your disc just gets herniated, which is obviously still a serious thing, and it's going to cause you quite a bit of pain. But everyone, well, I mean, a lot of people think that you should get surgery straight away, where new research is coming out now saying 2 out of 3 slipped discs or herniated discs don't need to become operated on, and they can be fixed with non-invasive treatments, you know, such as physical therapy.
Which is a big deal, right? Because somebody could be suffering with, you know, chronic back pain, acute back pain, waiting for you know, a surgery date to come through, which could take weeks, if not months, before they actually get the surgery and get full recovery. But in reality, they could come down to see somebody like yourself, and that pain could be alleviated, not necessarily immediately, but certainly they could be lessened. That pain could be lessened, right?
Yeah, exactly. And I mean, like you said, when they're on these large waiting lists, which it's understandable why there is a waiting list, but while they're on these waiting lists, they're not doing any corrective exercise. They're not trying to strengthen themselves, because regardless of whether you have surgery or not, you're going to need to strengthen. Say for herniated disc, you're going to need to strengthen the muscles around your lower back to support it better, so the spine has more support.
So you may as well start a corrective exercise program sooner, because you, even with the surgery, you're still going to have to do it.
Exactly. And like we say, going back to the principles we use, the stronger you are, strictly speaking, the less likely you are to pick up an injury, because the more robust your body's going to be. And it's kind of like you just need to, if you want to be healthy, you need to work for it, don't you?
Completely. Why do you think people do sit in side pain for so long before they come and see somebody like yourself, or they're waiting on a NHS waiting list for an operation? Why do they tolerate that pain? Why do they suffer?
I think it's because they think they have to. It's kind of like it's almost like a lack of awareness of, and that's through no fault of their own. It's just because it's not advertised enough. Maybe people just think that, you know, you get a pain, you go see your doctor, but you know, 9 times out of 10, you go to see a GP, they're going to refer you to someone else anyway. And so if you can do that self-referral, if you can do that referral yourself, you're going to, one, cut out the middleman, and 2, really just get educated on pain. And that's another thing we love to do with our clients. Obviously, it's all very well and good we fix people, but we almost want to get people to the point where they don't need to use us in case it's an emergency, where we want to get people to a point where they know what's going to go wrong, they, you know, don't overdo it, and they know how to fix themselves, essentially.
Something that I've personally kind of worked on, and as you know, we've discussed, you know, my training with inside Plymouth, the Plymouth community in the 5 a.m. club. One of my main goals was to make my clients redundant of me. You know, educate the client, give them all the tools, the skills, the strategies, the principles behind this is how you get yourself in shape, whatever their goal is. And there comes a point where you go, you don't need me anymore.
Exactly.
And I think that is that's something I really want to promote inside the FitPro Sessions and the parallel coaching community. What's your thoughts on that, boss?
Yeah, massively. I mean, firstly, shout out to Neale who did the 5 a.m. clubs with you, because I see him in the gym that I go to now, and he talks very highly of the 5 a.m. club, and a lot of the stuff he does now is just a continuation of what you taught him. And I feel like people are almost scared to lose clients, but I try to use like the driving instructor formula, where, you know, when driving instructors do their job properly, they don't have a client anymore.
Completely. So do you reckon people, trainers, sports therapists, coaches, personal trainers, yoga instructors, Pilates, whatever their coaching, you know, specialism is, do you reckon they don't go out to truly impact the client because they're fearful of losing the client, or what?
It's a weird one. Like, I feel like certainly there will be people that do that,
right?
It definitely is. I mean, certainly there are people that will do that. I thankfully don't know too many, but obviously you hear stories and stuff. I feel like sometimes like client retention is something that people worry about, but if you do your job as well as possible, you're going to get that client retention. And then once a client's fixed, they're going to recommend people to you anyway, because people are always going to be in pain. In your industry as well, people are always going to want to get fit and healthier and stronger. So you're always going to have that clientele there. It's not like you're going to run out of people in the world, is it?
So yeah, completely. So but there's always going to be unfit people. There's always going to be people in pain.
Exactly.
Certainly for low back pain or injuries, sport-related injuries, or everyday injuries that happen in and around the house and workplace. So they're always going to become flooding in. I suppose the key part here is for me as a fitness professional is to do the best, most outstanding job I possibly can, so that they get the end result. For yourself, your clients go away pain-free and go, wow, that was an amazing experience. Let me go and tell the whole wide world about you.
Yeah, exactly. And that's the thing, like with our jobs, say on a long day, I'll be in for 13 hours, but that's 13 people I've impacted, and that's 13 people who are grateful for my time. And for me, I wouldn't really want to do my job if I wasn't trying to fix people as soon as possible, because for one, it's always good for the ego when you fix people. But two, that's what I'm in the job for, to, as well as being able to afford money to eat. It's always just helping people out and, improving their quality of life, because I didn't really think about it when I started the degree, obviously, but when you start to realize what an impact you can make, it becomes almost
and how hungry you are and how much you want to eat on a day-to-day basis.
Exactly, mate. Yeah, I eat a lot as well, so I'm always motivated to work.
Superb. With so you've been in business down in Plymouth for a good few years, and I was reading online the other day that 80% of those people that start out in coaching after 18 months are no longer doing what they set out to do, which is a crazy stat. So you're 4 and a bit years in, so I want to tip the hat right there and say well done, because you've got past that benchmark. And what do you see as the common reason for, I'm going to say, why are people failing? Why are coaches, hanging in the towel and hanging up their boots after 18 months? What's the cause of that, do you reckon?
I suppose it's like with anything multifactorial. One thing might be they just don't enjoy it. It's maybe not what they thought it would be.
That's a real good point. Yeah.
Sometimes it might just be that it's a lot harder than they thought it would be as well, because you tend to see certain coaches or certain sports therapists and they're doing really well, but you don't see obviously the hours they put in behind the scenes of how hard they're having to work to keep that going. And I suppose another thing is just
I think the key part there would be something we see, on in parallel, and learners that come through from other providers, as a generalization. They've had a wicked transformation in their own body. They've got super fit, super healthy, and gone, I want to do this. I want to impact loads of people and do, become a personal trainer. Or perhaps for your clients, they've been in so much pain, and then all of a sudden they're like, I'm pain free. This is wicked. I want to become a sports therapist. But it's not until you actually get into the job role itself and you realize this is nothing like what I thought it was going to be.
Yeah, of course. Yeah. I couldn't agree more with that. And I think, especially with your job, people who have such a good, say body transformation, sometimes they can't always get that for other people. They might just be genetically gifted where they can do it really well. Or sometimes it's just because you're good at something, or just because you enjoy the experience of something, doesn't always mean you can coach it or teach it or deliver that service to someone else that well.
Yeah. Any other reasons? I jumped in. Apologies. You were just.
No. You got in my train of thought, mate. To be honest, I do just think it's because people want to do stuff they enjoy, and it's probably not what they expected it to be. So that's why they're not going to enjoy it as much anymore. So that's why they tend to drop out of it a little bit.
Cool. Let's jump forwards then with where you are now. You've got clients. You've just mentioned you've had 4 clients in already today. Sometimes you can do 13-hour days. And we've already mentioned you have this consultation test or screening at the beginning. Tell us a bit more about the journey of a client and the specifics of those sessions, if that's possible.
Yeah, so the start of the journey is never nice because they're in pain.
Does this hurt, prod? Does this hurt, prod?
Yeah, exactly. So what we like to do is we get people in, and obviously I think first and foremost you want to just connect to them on a semi-personal level where you can get on with them. Then we want to get to grips with what their injury actually is, and really just educate them on why they're experiencing pain, what's causing their injury, and why they're in the condition they're in. From there, we like to outline a plan, and so the consultation is usually quite lengthy. However, if I can just do a little bit of like physical treatment on the first session and just show them that effect, because obviously it's good to tell them what's wrong and how we're going to do it. But if you can then just prove to them, by doing X, Y, and Z, you're going to get that much better, it really just puts them leaving that first session in a positive state of mind.
It's like a quick win, isn't it?
But yeah, basically. And it's once you can get people on side and actually, get their own self-efficacy and believing that they can improve themselves, that's when you're fighting a winning battle.
I think that's key, isn't it? For not to take those skills, not just from, say, a sports therapy perspective, but something we teach inside the PT course as well is, that first screening session, first consultation is about building up a relationship, building up the rapport with the client, show them that you're talking, you're listening to each other, you're building up this picture, and then performing a number of tests to, find out where we're moving forwards, what's the goal, what are we heading towards, and then you can, then jump into some kind of action. But that action on the first session or first 1 or 2 sessions needs to show them or instill an element of belief or self-efficacy that what they're heading towards can be done.
Exactly. And those tests are crucial as well, because when people tend to live with pain, because it's such a subjective feeling and their improvements might be very gradual, they're just used to the pain they're in. And whereas they might come in with a 10 out of 10 pain and it drops down to a 5, if that's happened gradually enough, they might still think their pain hasn't changed. And that's why if you write down some objective markers such as, the strength, the weight they're able to carry, or the range of motion they have, or the, function of movement they have, if you can then write that down and show them the improvement over time, that's going to obviously make them feel better and, let them know that they are actually making improvements.
Whereas the subjective measure of how they feel on a Likert scale of 1 to 10, it's always going to be perceived based on how they feel that day.
Exactly.
How much food they've had, how they feel, how much sleep they've had, how much, whether they're hydrated. Whereas if you've got that objective measure, you can categorically say this joint now moves X number of degrees more. And exactly. It's inarguable. There's no grey area now, is there?
Exactly. And pain is such, it's a topic that I love, and it's such a multifactorial process that goes on, or phenomenon, that a person's reporting of their own pain can be sometimes quite unreliable in terms of a marker to look at. That's why those objective markers that I can see myself are very good to use, because then it just reaffirms to the client that they're actually getting better.
Why would you say they're unreliable? What expand on that one?
Well, just like we say, because they're in that, they can't take themselves out of their situation. Sometimes they're in it. And pain can be influenced by not just the physical state of their body, but the stress they're in that day, how much it's affecting their life, their own belief about how their pain is going to affect their quality of life going forward. So if someone's got quite a negative mindset, their pain is always going to be a lot higher than it probably should be.
And if you live with that for any length of time, really, you're going to become numb to that pain. So it could be actually presenting a physical pain of, say, an 8 or 9 out of 10, but they're reporting something different, maybe more or less, purely based on they've become numb to it, and it's become an everyday part of their life. Living in pain is now reality. So
exactly. So on the flip side of that, you don't want them to be like, oh yeah, it's only like a 4 out of 10 today, and you think, okay, cool, we're going to get you doing this, and this, because just based off that, it would be unreliable. Yeah, exactly. Then I would, then I'd be injuring them further, which is kind of the opposite of what I want to do.
Is there any? Obviously, there's you don't want to. A personal trainer or fitness professional doesn't want to cross into the boundaries of what you do, and vice versa. But is there any particular tests that you think would be relevant for a fitness professional to do to help screen a client when looking at, say, just understanding posture, tight and weak muscles, and understanding how somebody moves?
So in terms of the tests, to be honest, one of the first tests you'll do is just seeing how someone carries themselves. But in terms of like personal training, it's just whether the person that such as yourself would be training, whether this individual can do the exercise you want them to do correctly, essentially. And if they can't do it correctly, then you'd want to see, right, if they can't squat properly, you'd want to look at, right, is their ankle moving as much as it should be? Have they got a hip impingement or something like that? But yeah, the main test I would just use is, can they do the exercise I want them to do efficiently and safely, more importantly.
Yeah, one of the things we teach is a squat assessment, like an unconscious squat assessment, so the client doesn't know what you're looking for, and then again, just working up the body from the ankles, comparing left and right, coming up to the knees, what impact, what can we see that's from the ankles that's affecting the knee, that's affecting the hip, and then working our way up the joints of the body to think, how am I carrying myself posturally?
Yeah, and so that's another nice thing that I kind of like to do tests on my clients without them realizing. So say, for example, if someone can't walk upstairs, we've got an elevator in our offices. But most of the time, if people can, I'll get them to walk up the stairs. And if, say, on the first session or two, they're kind of limping a little bit up it, then on the third or fourth, they're walking up fine. Once they've walked up the stairs, I'll be like, oh, look, you've just walked up the stairs fine. And then like, oh my God, yeah, I've improved quite a lot. Or like hopping on the massage table. First time they do it a little bit gingerly, then if the second session they just hop on, I'll be like, oh, that was a lot easier than last week, wasn't it? And then that just reinforces the benefit that the treatment and the stuff they're doing at home is having on them as well.
Completely. And because if you turned around and said, I'm now going to watch you walk up the stairs, or I'm now going to watch you get on the massage couch, they're going to make a conscious effort to either stay in pain or move in a conscious way that tells you they're not in pain.
It's like the observer effect, isn't it? As soon as someone knows you're watching them, their actions are going to change. That's why even when I say I'm looking at someone's posture, I'll just try to be like, okay, I just want to look at the movement of your shoulder, and when they're standing there, I'll just quickly have a look at how they're holding themselves first, and then look at the movement of their shoulder, for example. Or like we said earlier, as soon as they walk in, you can kind of just get a quick idea of what's actually wrong with them and are they carrying themselves wrong.
One of the kind of common questions that we get asked a lot on Messenger and Facebook from personal trainers and fitness pros all around is questions around lordosis, kyphosis, and scoliosis. What's your thoughts or opinions around those conditions? Just in general. Just to jump back in, just to add I'll add some context on that. So a classic question would be, my client's got lordosis.
Yeah.
And my initial response is, have they been diagnosed with that? Or is that you diagnosing them? Or is that something you're seeing? What's going on?
Firstly, you need to look at what's actually causing that. Is it congenital and is it something they're born with? Or is it something where, you've got a tightness in the muscle, which is, say, for example, with lordosis, is it anteriorly rotating their pelvis, which is then causing them to present with that, where they haven't actually got it fixed? It's just something that is temporarily there. Then also, what can you do to obviously resolve it? But what I would say with posture in general is there is no ideal posture. Everyone thinks of the perfect posture, shoulders back and down, chest up, and etc. But if you hold that position for 8 hours a day, you're going to get injured anyway, or you're going to feel pain from it anyway. So the perfect posture is like a moving posture.
So you're telling me I don't want to be sitting here in my, anatomical position I see in the manuals. And
I mean, if it's comfortable to do and it's not causing you any pain, then go for it.
I'd rather slouch, to be honest. It's a bit more comfortable.
Yeah, exactly.
I'll book in an appointment next week to get me out of that position.
yeah, exactly, mate.
This is the FitPro Sessions Podcast with Parallel Coaching.
So we just mentioned about kyphosis and a fitness professional's understanding of that. Another question we get asked an awful lot is around the barriers that they face as a fitness professional when a client walks in. Let's say, for example, a client walks into you, they're presenting a lot of pain in their low back, and they've just got loads of reasons or justifications about why they're in that position, and they can't go and do the exercises. They can't attend the gym or whatever you've prescribed. How do you overcome those barriers that clients present to you?
Well, what I would say is, firstly, just break it down. So for some people, going to the gym is that's almost like an end goal and quite a big task. So just break it down and say, right, so instead of you going to the gym to train, I'll just get you to do certain very light exercises at home. And once they do that, once they've mastered an exercise at home, they're going to be more comfortable to go into the gym to do that exercise, and just really build from there. So any large task that they have that they're kind of blowing up in their own mind, to be bigger than it is. Really just break it down into sort of digestible steps.
Which comes back to, you mentioned earlier about self-efficacy, someone's belief of whether or not they can or can't do it. So if somebody believes, I can't get to the gym this week, or I believe I can't do that part of my program because of X or because of whatever, it's breaking it right back down, giving them something really simple, tangible, easy to do, that they can believe that they can do and fit that time in.
Oh, of course, yeah. So like self-efficacy is so important, particularly in pain, because pain is created in the brain. Obviously, we have physical contributing factors to that as well. But pain occurs when the brain perceives a threat to the body. And this threat can also be fed into when people don't think that they're going to get better. They don't believe that they can, make themselves better. So by giving them that self-efficacy, you are literally going to reduce pain. I've had sessions where I've had initial consultations where I've not actually physically treated anyone, but just through talking through their experience and just giving them someone to listen to, and talking to them about how we're going to fix them in the future going forward. That has then, without me having to, actually put a physical intervention into place, they've walked out in less pain than they had when they came in, because they're more confident and more, and their self-efficacy is higher than when they came in.
I was going to say, how much of your job role as a sports therapist is mindset and behavioral change, as opposed to physically getting somebody on the couch and manipulating a muscle?
The mindset is just crucial. If someone doesn't believe in what you're doing, and if someone isn't on board with you, your treatment will still work, but it just makes it so much easier when they actually believe what you're doing is going to help them. So I can't really give you an exact percentage. Most of the time we do treat people with, like sports massage, taping and what have you. But a lot of the time it's just about making sure that I'm doing my job in here, but then letting them leave with the motivation and the sort of encouragement that they're going to go away and do the corrective exercises. They're going to make the changes to their routines, and do everything that they can to improve their condition.
Otherwise, they come back in a week's time or 2 weeks' time or next month, and they're no further down the road. And that's a key point that we bark on about on our PT courses. You might only see your client once a week, but what do they do for the other 167 hours?
Exactly. And I always forget how many hours there are in a week, so I'm glad you said it.
168.
Yeah, there we go. So I would say to people the same thing. Like, look, even if you see me once a week, I see you for an hour a week, you've got 167 hours per week where I'm not seeing you. It's not all down to me. You need to be doing your stuff. I'm like a coach in a way. I'm guiding people through their recovery.
Yeah.
And yeah, once you get that point through to people, they feel a lot better about what they're doing, and it puts the responsibility back into their hands.
And that's why that session or that 1 hour that you do have with a client, it's important that there's a serious amount or weighted amount of communication there, so that they value that this is possible, that they can go away and do this. So quite a bit of that is talking, isn't it? To be fair, it's not actually doing. It's allowing them to go away with the skills, the tools, the strategies to go and do the work the other 167 hours of a week.
Yeah, of course. Yeah, it's showing them that as a coach or a sports therapist, you actually want them to get better, but it's just about educating them on and filling in the gaps of their knowledge about what's causing them pain and what they can do to fix it.
Very smart. Let's jump into another learner question. Sarah says, my clients typically turn up with plantar-fasciitis.
Okay.
What can I do or can't I do with this person? So I know a little bit about Sarah. She comes from a running community.
Yeah. So what I would say is you're going to need to take away whatever's causing aggravation to that area. So depending on the severity of it, if they're doing single leg work and that's causing a lot of pain, try doing bilateral work. So instead of pistol squatting, try squatting. I would certainly take away running for the time being. And to supplement the cardio work, do something low impact, such as running, swimming. Swimming's always a great one to do. Not running, sorry. Cycling.
Swimming,
do something like it's something like that. Swimming's always a great one because it's so low impact as well. You could try cycling, but obviously that is putting a bit of a pressure on the plantar fascia. And then basically giving them strengthening exercises for the foot, because you can actually strengthen the bottom of the foot up. Give them strengthening exercises for that, so that they don't need to run with supports or orthotics or anything, because their foot should be enough support for itself.
Completely. And also just making sure that we understand why the client is running in the first place. Are they running for a particular goal? Maybe they want to get a PB in the local 10K, or they're going on to do a marathon. They got London next April or whatever. But so many runners turn up for a social element. And
exactly.
if they're turning up to a running club with plantar-fasciitis and you turn around and you say, right, you're going to go to the swimming pool now, or you're going to go on the cross trainer, suddenly you've taken away the very thing that they're going there for. So it's understanding how to adapt inside their goal, if that makes sense.
Yeah, exactly.
If I take running away from them and put them in a gym on a cross trainer, they're not going to attend, because their goal was not about fitness. Their goal was about having a chin wag.
Exactly. And so this is the thing, like, as much as I can say, right, don't run, do this, this, and this, and do this to work your cardio. Like you said, they like it for the social aspect as well. A lot of people do. So I would say, okay, maybe if you're going to go to the gym, invite your friend along, or maybe go to the gym and then reward yourself by having a coffee with your friends or something like that. So you're still incorporating that social aspect to it as well.
I suppose that comes back down to you as the coach, isn't it? Of, going, well, I want you to get your goal. I want you for you, I want you to be pain-free, but I'm not necessarily here to tell you what you want to hear. I'm not here to kind of be your best mate. I'm here to guide you to the end outcome.
Yeah, that's the thing. I say to a lot of clients, some of them are going to love me because I'm helping them out, but some of them are going to hate me because I'm taking away what they enjoy to do. But then again, I say to them, I'm taking it away temporarily. We're still going to, I never want people to rest fully. We want them to be always doing something, always moving forward. But yeah, sometimes you kind of need to put your foot down and be like, no, I don't want you doing this. If you do, you're going to keep getting injured.
Because the reality is, once they're pain-free, or once they're heading towards, for this person, plantar fasciitis has calmed down, they can return back to their running and run further, faster, and be fitter and stronger. And
exactly.
And not get home after a session thinking, shit, my feet really hurt, I shouldn't have done that, and regret it.
Yeah, and you need to have that conversation with someone and just be like, look, isn't it worth like taking maybe 2 to 3 weeks out now and then being able to run for the rest of the year healthy, rather than running for the rest of the year with pain?
That's a simple combination for me, to be honest. I know what I'd choose.
Yeah, exactly.
I got a couple more questions. I know we're tight on time, so you got a client coming in very shortly.
Yeah, no problem,
one more question, one more learner question, and then 2 more from myself. So James asks, why do you think, and I think we've kind of answered this already, but why do you think anatomy and physiology is important for a coach or a fitness professional?
Purely, well, I'd say the mechanic needs to know everything about the car, and as someone trying to fix or strengthen the body, you need to know all the working parts that you're dealing with. You need to know what exercise or whatever intervention you're giving to someone. You need to know why you're doing that and what benefit you're trying to get out of it, and having an understanding of the physiology and anatomy of the body is just crucial in knowing that.
We used in one of our first revision podcasts last week, we used the analogy of a mechanic and the car. The anatomy is obviously the study of parts of the body, whereas the physiology is a function of those parts. And we said, would you give your car to a mechanic that didn't know anything about the parts of a car and didn't know how to put them all together so they worked? You'd be like,
yeah,
no, of course I wouldn't. Why would I do that? That's stupid.
Exactly.
And that really summarizes, why is A&P important? So it's really cool that you used the same analogy as we did.
Yeah, exactly. The only thing is with cars, you can put new parts on and you can't for the body. So we need to do the best of what we've got.
Exactly. You can get a new knee, a new hip, but that's not the route you really want to go down.
Yeah, exactly. Yeah, exactly.
So it's up to us to, plan and deliver a safe and effective approach towards a goal.
Yeah, of course. Yeah.
Cool. So I've got 2 final questions, boss. Based on life today, all your experiences, you've been involved in sports yourself, inside fighting sports and whatnot. You've experienced a ton of different sports and injuries and different reasons why people come to you in pain, and you've been a sports therapy for many years. What 3 things or tips of advice would you give someone wanting to start out as a coach or a therapist or as a personal trainer?
3 tips. The first one would be you got to like people and get on with people well. Second, you need to be able to work hard. But thirdly, and most importantly, I think you need to want to help people and really get just satisfaction out of seeing other people achieve their goals, because that's one of the best things about my job, just the difference it actually makes to people's quality of life.
Very smart. So I love that last bit, just that first for I want to go out and help people as best I can.
And it sounds a little bit cheesy and whatever, but it's a great feeling. And being able to help people, there's nothing better than that, really, is there?
Cool, man. Very smart, very smart. So final question, and I want to acknowledge your time today, your energy, your effort, your passion for helping people, for getting people pain-free, for going into your studies and inquiry skills further, so you can become a master of your game and approach to coaching. What is your definition of an outstanding coach?
So an outstanding coach is, again, like someone who wants to help people, someone who can motivate and connect with someone. But especially, I find a good coach is someone who can convey their message using as little communication as possible, whether that just be a few words, a look, something like that.
Very smart. So we use this analogy. I've said it a couple of times in the podcast previously about, if I can break down a complex topic and convey that using Crayola crayons and as if I'm going to talk to a 5-year-old, then my job is done.
Yeah, exactly. And if then people can go away and they know the message you've tried to convey to them, and I think you've done your job.
Very cool. Very smart. Is there anything else you want to add, Kyle, before we log off today? Anything I should have asked but haven't done?
Not really, mate. I think you've done a pretty bang up job. I would just say any coach that wants to get into it, use parallel coaching.
Thank you very much.
Plug there. And no, mate, just thank you very much for your time. Thank you for having me on as well. I've really, really enjoyed it.
Nice, superb. Thank you for coming on. And the only thing is, we haven't got many Ron Burgundy quotes in throughout.
Yeah,
I should have had a crib sheet along the side, but
we'll have to do another one, mate.
There we go. So stay classy then, Kyle Simpson. Stay classy.
Stay classy, San Diego.
Cheers, see you later, boss.
Cheers, bud.
Cool.
Cheers.
Hi, I'm Neil Bergman.
And I'm Hayley Bergman. Over the last 10 years, we've helped thousands of fitness professionals to get qualified, learn with simplicity, and coach clients with confidence.
We're the first to say that learning and being a fit pro doesn't have to be hard work, and that with the right structure, support and resources, you can become a confident and knowledgeable fitness professional that is dedicated to more.
So how do you learn, qualify and kickstart as a fit pro? This is the FitPro Sessions Podcast with Parallel Coaching.